How to relieve low back pain, instantly. Lower back pain is common health complaints in young adults. The most common cause is muscle strain, often related to heavy physical activity. Lifting or forceful movement, bending or twisting into awkward positions, or standing in one position too long. It can be acute or chronic, which depend on the duration of the pain. Most low back pain is acute, or short-term, and lasts a few days to a few weeks. Subacute low back pain is defined as pain that lasts between 4 and 12 weeks. Fortunately, there are remedies to combat the ache, from exercising to getting better sleep to reducing your stress levels. You can choose from a variety of strategies the next time you have a backache, or if you are suffering from one now. Consider the following methods of back pain relief. Remember to discuss at-home back pain remedies with your doctor before you make use of them. Remedies to relieve lower back pain. At Sporty Witty, our mission is to encourage people, of all ages, both men and women, to make physical activity, and outdoor sports, a part of their daily fitness routine. So, stay connected, and subscribe, and press that bell notification icon to stay updated. Exercise to loosen muscles. Although it may seem counterintuitive to exercise when lower back pain is causing you grief, the right kind of movement can help eliminate the discomfort. It's always important to consult your physician before you engage in exercise when you have pain, but this conversation is well worth having if you are suffering. General stretches. This is mostly basic ones like 1. Stand and bend forward to touch your toes. Hold for a while. 2. Lie on your back, arms out to your sides stuck to the floor, bring your legs up, bent at the knee. Now drop them to one side, hold for a while, repeat on other side. 3. Sit on the floor, legs facing outwards like you are stretching your hamstrings, bend at the waist. Reaching for one foot, hold for a while, repeat on other side. Swimming. The buoyancy of the water and low-impact exercise relieves muscle tension. Swimming gives the option to work out just as well but with a more therapeutic element. Bar work. Hanging from a horizontal bar is actually enough to stretch out my entire spine and muscles. As you progress to doing chin-ups and hanging leg raises, the movements relieve the knots in the back from varying angles. You can find a bar in any park in your neighborhood. Yoga. It's low impact, stretches all body parts, and really challenges your flexibility. The yoga stretch known as child's pose can be helpful in easing lower back issues, or a knee to chest stretch may also help. When you stretch the piriformis muscle in the buttock, you can reduce tightness in the buttock and lower back. Gently twisting your spine while seated may aid in increasing your mobility. Other stretches that might work for you are the cat-cow stretch, which can invigorate the spine, and the Sphinx stretch, a backbend stretch that can strengthen the chest, spine, and buttocks. Use hot, cold treatments. Another effective method is hot and/or cold therapy. This remedy is easy to implement, and it's also an inexpensive option. Certain varieties of aches might be alleviated with the application of heat and/or cold. This may include lower back pain stemming from common causes, such as spinal stenosis. If you have sustained direct lower back pain from an injury such as a collision, a fall, or a sports injury, hot, cold therapy could be a solution. Other kinds of aches that may be minimized from hot, cold applications include sore muscles from exercise, as well as a pulled muscle that results from straining the back. The type of pain you are experiencing should dictate the kind of hot and/or cold therapy that you choose. If your ache is acute, you should apply cold and then heat. If the discomfort is chronic or subacute, mild heat should be applied continuously. If you are trying to lessen soreness after exercising, you should apply ice. You can use hot and cold packs available in stores, or you may want to try making your own hot and cold packs at home. Engage your brain. Pain is considered more than just a sensation. You can engage in brain activities that include pain management or cognitive behavioral therapy to help you manage pain better. This seems inconsequential, but trust me, It works well enough and even affects your productivity in a positive way. Reduce your stress. Prolonged periods of high stress may harm various aspects of your health, including your back. Stress can affect the way that you breathe, and this may result in tension and straining of the back. To reduce stress and decrease the chances of stress-related discomfort, consider making some gentle changes in your habits. Eating healthier foods can help to keep stress at bay, while making time to relax is also crucial. Spend quality time with yourself and your loved ones so your spirit remains strong when life is challenging. This may indirectly lead to a healthier back. Get better sleep. Getting enough rest is another important strategy for keeping you in good shape. If you aren't sleeping in an optimal position, you may become sleep deprived. Poor sleep posture can also cause aches. Be sure that your spine remains in a neutral pose, and try to sleep on your back. If you have trouble sleeping unless you're on your side, you should alternate sides periodically. Don't position your pillow underneath your shoulders, instead, it should be placed beneath your neck and head. Getting the correct mattress is also critical. If your waist is narrower than your hips, opt for a relatively soft mattress. A more rigid mattress is appropriate if your waist and hips are close to the same width. Get better shoes. The shoes you wear can certainly have an impact on the health of your back and may actually be one of the best and most obvious lower back pain remedies. High heels are known to contribute to problems in many people, however, simply wearing flat shoes is not necessarily the answer. Appropriate arch support and cushioning of the foot is vital, and doing so may significantly aid in pain management. Getting orthotic insoles is one way to maximize proper mobility and comfort and get rid of back pain. If your symptoms persist for more than 3 months, then you may be suffering from chronic lower back pain. That's better, you should consult with your doctor and therapist for the diagnosis and treatment. Physical therapy programs to strengthen core muscle groups that support the low back, improve mobility and flexibility, and promote proper positioning and posture are often used in combinations with other interventions. Your doctor will diagnose it properly. They will examine your back and assess your ability to sit, stand, walk and lift your legs. Your doctor might also ask you to rate your pain on a scale of 0 to 10 and talk to you about how well you are functioning with your pain. They may need X-ray and MRI for the diagnosing purpose. What works best for you? Do let us know your comment below, and if you like the content of this video, do not forget to like, share and subscribe.